Good morning, Mina. How are you?
Good morning. I'm doing pretty well.
Great to hear. Thank you for sharing this space with me this week again. Before we get into things, just wanted to make sure that you're in a safe and confidential space.
Yes, my kids are out, my husband is out, so I am good.
Okay. I'm just going to be kind of opening up the floor for some heavy things, like per usual, every week. But no pressure. If the kids do come in or your husband, we can always take a pause, as we've discussed before. So no worries. Just want to make sure before we get into it.
Sounds good.
All right. So I want to start by acknowledging all the great work you've been doing. I know our treatment plan that you and I created together really focused around understanding your bipolar diagnosis that was fairly recent when you first came to me and we first met each other, as well as understanding that medication. Um, from what we've been talking about in session, I'm getting that you're beginning to feel more comfortable. But how are you feeling about it?
Yeah, I think I feel like I better understand where my feelings are coming from. I know when we first started talking, I told you I felt kind of crazy and I just didn't really get what it all meant. But I think through our work, I've kind of understood better where my feelings are coming from and that it's okay to feel this way, that I'm not crazy.
Yeah, it's it's great to hear that you feel like you have better understanding of this diagnosis yourself, the impact that has on you, kind of the feelings that you're having associated with it. That's exactly, where we wanted to work towards and be. So I'm glad to hear that. Um, I know that our other big goal that we had was understanding what being a more patient and calm mother would look like for you, kind of what that means as well. Um, I'm seeing kind of more openness about that with you, an active, implementation of coping skills to get to that point and to maintain and sustain that calm and patient demeanor. How are you feeling?
I think I've definitely made a lot of progress. I think it's still really tough sometimes that when I get overwhelmed, I still have, some of those feelings. But one thing that's really helped is how we talked about taking a step back or like leaving a situation that I feel overwhelmed. And I didn't think this was going to work, but I'll count to 10 in my head. I'll count my breathing, and just do my breathing exercises. And then it actually helps. I can go back and handle the situation better.
Yeah, like I mentioned before, your implementation of the coping skills and kind of adapting it to your lifestyle has been so great to see and to support you in that process. I know you had expressed initially some concern with taking a step back, especially with little children, can be difficult as they're always wanting to be near their mom, their parent. So I'm glad to see that you've adapted it to fit your current lifestyle, and then it's actually really coming in handy for you in those moments where you're identifying what sounds like triggers, um, which is another thing which we've worked really hard on identifying. You've done great work in our sessions to do that, deep introspection and really be able to identify those triggers. So knowing when to implement these coping skills is a big and a positive step and towards progressing towards your treatment goal. So I'm glad to hear it and great job. So, before kind of delving into this next subject, it's a little heavy, so I want to make sure that I'm kind of setting the stage for you. But you might recall from our intake that I did disclose information in regards to assessing whether somebody was a danger to themselves, a patient was, or a danger to others. Really, the point of me asking you these questions is to help you plan for your safety and the safety of others around you. So we'll be asking you about kind of um, topics such as rather self-harm, um, thoughts of suicide, thoughts of hurting somebody else. Are you okay if we proceed with that?
Yeah, that's okay.
Okay. So, um, my first question would be is, do you have a history of self-harming?
Yes. Yeah. I did it a lot when I was a kid. It led to quite a few hospitalizations.
Okay. Yeah. I know you had mentioned that before. I appreciate you again talking about these really hard things and heavy things with me. Do you currently have thoughts of self-harm?
Well, I guess, yeah, I definitely still have thoughts.
Okay, you still have thoughts. Have do you currently have a plan or intent of acting on those?
Mm, yes and no. I mean, I think it used to be a lot worse. Like I used to cut myself like on my wrists, but now I just kind of use a rubber band, so like it hurts, but I think it used to be a lot worse.
Yeah, what I'm hearing is that maybe you've worked on it to get it to a point that's maybe a little bit more manageable. Again, I feel like this is a place where coping skills might be of use in supporting you and further progressing towards eventually, being able to not um, engage in any type of self-harm. But the reason I'm asking these questions again is safety. And maybe we could talk about safety plan after we kind of discuss the other two topics. Does that sound good?
Yeah.
Okay. So do you have any history with suicidal ideation?
Yeah, I think that kind of went along with my self-harm as a kid.
Yeah, that makes sense. Um, from what you shared with me before, the heavy things that you were experiencing, kind of. Um, so do you currently have thoughts of suicide?
Sometimes I have the thought, yeah.
Okay. Do you have a plan or intent to carry out that plan?
Mm, sometimes I think maybe I should just grab the bottle of pills that I have, but I've never actually wanted to do that or made a plan to do that.
Okay. Again, your transparency, thank you for that. It's hard disclosing these things, verbalizing them sometime, a lot of the time. So I appreciate that. And then you did mention medication. So but you said that you've never had like the actual intent to act on it. Okay,
No, I've never tried.
okay. Again, just based off of your responses, maybe safety planning is something that we continue to revisit and assess, if not, today at the end of the session. So, lastly, do you have any history of, or rather, history of thoughts of harming others?
Yeah, I think it's gotten a lot better with my coping skills, but I do still have those thoughts of hurting other people pretty often. And that's what scares me because I really don't want to hurt my kids or my husband.
Yeah, I I hear that. I appreciate you again answering these questions. Um, I know you disclosed you've had the thoughts, not something necessarily from what I heard that you would act on or intend to act on. But do you have a plan or intent to carry out harm harming others?
No, I don't have any. I don't want to for sure.
Okay, just making sure. And then do you have access to a means if you did?
I guess I would. I mean, we have things that could hurt others around, but like I said, I definitely don't want to hurt anyone.
Okay, great to hear. Just wanted to make sure I asked those questions. Um, Again, thank you so much again for always being so open and willing to have these heavy conversations with me. You've been doing great work implementing your coping skills in your everyday life. We can talk about it more if we're safety planning about what we just discussed, self-harm, suicidal ideation, harming others. Um, and implementing and kind of integrating possibly new coping skills that might help with these thoughts. But again, thank you for answering the questions. All right. So I wanted to take a second again to acknowledge all the progress you've made. Our weekly meetings have really indicated to me that you're putting in the work. Not only are we talking about these things in our time, but you're going back, you're going home in your everyday life and practicing them. And since you've been doing so well, I wanted to begin discussing with you closing out services. Now that won't be immediate, it would be a transition. What it would look like as we go from weekly to bi-weekly to eventually maybe every 3 weeks or once a month, and then doing more of like a check-in. Is that something you're open to?
Yeah, I think that sounds good as long as we take it slow.
Course, yeah. And again, it's to give you the opportunity to really practice on your own, more so, a little bit more distance from me, all the great work you've been doing, continuing to attend your DBT groups and having those support, that support if you need to fall back on it, but again, practicing that autonomy. Does that sound good?
Yes.
Awesome. So we can proceed with, like I said, safety planning and scheduling out for next week. But thank you so much for your time, Mina.
Thank you.
Take care.